Introduction. Professional teeth cleaning is performed at a dental office to remove plaque and tartar from the teeth. Plaque is a sticky film containing bacteria that forms on the tooth surface. Tartar is mineralized plaque that is hardened and difficult to remove with a toothbrush. Excessive plaque and tartar deposits can lead to gingivitis or inflammation of the gums if left untreated. Regular professional teeth cleaning helps prevent decay and treat gum disease. Scaling, a procedure to clean the area below your gum line, may also be performed while cleaning the teeth. Your dentist or hygienist uses a manual scaler or a high-speed ultrasonic instrument to clean the tooth surfaces. Indications: teeth cleaning and scaling are recommended twice a year, or more frequently if you have a gum disease or excessive plaque and tartar buildup, before the procedure. Prior to the procedure, your dentist will review your medical history and perform an oral examination. A small mirror and a probe are used to examine your teeth and gums. Procedure. All tooth surfaces, including the areas under the gum line, are cleaned by either scraping off plaque and tartar with the manual scaling instruments or passing the vibrating tip of the ultrasonic scaler. Water is used to flush out the debris. You may experience some bleeding, which is normal during the procedure, especially if you have swollen gums. If deep cleaning is required, it may need to be performed in 2 to 4 visits, doing one quadrant or half of the mouth in one session. Your dentist may use a local anesthetic to numb the area being cleaned so that you remain comfortable during the procedure. Once plaque and tartar have been removed from all surfaces, an electric brush with a gritty paste is used to polish the teeth. Polishing removes any tartar left behind, smoothing irregularities and buffing the tooth surface. After the procedure, if anesthesia was used, your lips and gums may remain numb for a while after the procedure. Later, your mouth may feel a little sore. If there was excessive tartar before the procedure, you may experience some tooth loosening. Inflamed gums gradually heal and become firm again around the teeth. Good oral hygiene, including regular brushing and flossing, is recommended. Risks and complications. You may experience some tooth sensitivity after the procedure, for which your dentist may recommend a desensitizing toothpaste. Some people experience minor swelling and bleeding following the cleaning, which subsides soon after. Summary: plaque is an invisible layer that continually forms on the tooth surface. Proper brushing and flossing alone are not enough to keep it in check. Regular periodic cleanings by your dentist will help keep your teeth and gums healthy.